Hi everyone, welcome to Fitness Fridays by Rosewalk, and I am Mahima and I have with me Dr. Veer. Hi ma'am.
Hi Mahima, hi everyone.
So we are back with our Fitness Fridays to ensure that you all are able to stay healthy and fit at home while following all the safety measures during these COVID times. So our today's topic of discussion is resistance exercises. I'm sure a lot of you might be already following resistance exercises in your daily workouts. However, some of you might not be knowing the importance of resistance form of exercises. So we will throw some light on importance of resistance exercises for especially women, and for you to understand how important it is for women to ensure that they follow some form of resistance exercises on regular basis. So, ma'am, please start with telling something about what exactly are resistance exercises so that people can understand better.
So, Mahima, as the name suggests, resistance exercises are a form of physical fitness where muscles or a group of muscles are put under resistance so as to build their strength. And now, resistance exercises can be of various types. You can use your own body weight for doing that. You can use dumbbells to do that. You can use gym machines to do that. You can use even simple things like fitness bands to do that. In Pilates, magic circles, magic rings, and Swiss balls are used to achieve this purpose.
Yes, so there are lots of different kinds of resistance exercises, and even if you're at home keeping the COVID safety in mind, you can still make sure that you do these resistance exercises at home while using the different forms that can be performed at home. So, ma'am, if we talk a little more details about what are the various forms or various types, could you tell us something more about individual types?
Yes, so I think most of the people are familiar with the gym exercises because they are synonymous with machine workouts and dumbbell workouts, and they are very important. And many people feel that if you do them, probably you'll really bulk up, and as women, you'll start looking like maybe more masculine. But I would say that's not true. It takes a lot of effort and deal to bulk up and look like the way you imagine yourself if you would be looking. Basically, resistance training, like a gym workout, helps in toning. Other ways to achieve the same, as I said, are home workouts. Home workouts would be like a yoga workout at home, Pilates workout at home, and even using simple props like wall. One could do something like wall push-ups, and resistance bands can be ordered on Amazon, and there are various exercises that you can do with that.
I think you mentioned a very, very important point here that yes, a lot of women think that if they do the typical gym workouts using weights, they will bulk up and get a very masculine body. So I think that's a very important point that as part of the women's health perspective also, weight training exercises are very good for improving the bone density also for women, especially during the menopausal period. So please do not think that you're going to bulk up your body and start looking like a masculine body, but it is important for women to ensure that they use some form of resistance exercises on regular basis.
Yeah, when women talk like that, I would just like to say that I said, please go and ask a man who's worked out with all the testosterone which is there in his body.
Yeah.
It's how difficult it is to bulk up and achieve that look. And you think, just by lifting maybe 2 or 5 kg weight, you're going to achieve that. That's not going to happen. That's for sure.
Right. So if you don't have any set of dumbbells at home, even if you have like a water bottle, you can just pick up a 1 liter bottle or a 500 ml bottle full of water, and you can use that also as a form of resistance training exercise.
Yes. Otherwise, weights are easily available on Amazon.
Yeah, so you can either buy some set of weights, you can use some resistance bands, like ma'am mentioned. It is very, very effective in starting off with resistance exercises, and there are different forms of the resistance bands also available according to the different levels. So you can start at with an easy level, then go to intermediate, then go to a difficult level, and then gradually you can even start off with 500 gram dumbbell, moving on to 1 kg, 2 kg, and gradually increase it to prevent injuries also.
True.
Because I think a lot of times many women, are very enthusiastic and they feel that no, I can straight away do a 5 kg dumbbell workout, and that can give them a high risk of developing a muscle injury also, right?
Yes, the form, I would say initially when you are starting, the form is more important than the actual weight you are lifting. So gradually build the reps, be sure that the form is correct, and the last few reps should be difficult. That means that the weight is appropriate for you. If last few reps are very easy and you can do a number of sets, that means you're using a lighter weight. You need to use a slightly heavier weight. And once you do this, you might develop soreness after 24 to 48 hours, which is called delayed onset muscle soreness. And it's a part of resistance training. No need to worry about it. It's caused because of the microscopic tears in the muscle, and they repair, and then gradually it becomes all right. So many people say that they have so much body ache after resistance training. In fact, yes, there's nothing to get scared of. It's the muscles and which are at play. In fact, your basal metabolic rate rises. So I would just like to speak on the advantages.
Yeah.
So basal metabolic rate rises, because of which the weight loss is more sustained. Weight loss becomes easier. You tone up. The shape of the body is better. It's like very often must have experienced or heard people saying that I'm going to the gym, I've not lost weight, but I've lost inches. So all that is happening because of the resistance training, because the muscles start and the body starts to shape up. The muscles are becoming stronger there. And other, as Mahima said, for postmenopausal women, extremely important. Bone density suffers after menopause, so the bone density is better. And because a strong muscle cannot rest on a weak bone. The muscle and bone strength go hand in hand.
So around the perimenopausal stage, a lot of times, women tend to develop osteoporosis or weak bones, because of which they are sometimes more prone to developing fractures also.
True.
So could you tell us something more about, how important it is for women, right, starting for like early 40s is like, the new time for women to get fit. So if you can mention something about how women in 40s can ensure that, they develop a regular routine of doing resistance exercises in their regular workouts. Can you just tell us more about that?
Yeah, see, many times people focus only on one form of fitness. For example, I am not against walking or other forms, but sometimes people feel if they are walking, that is maybe enough. It's a good place to start with. It's better than just sitting and doing nothing for sure. But walking, jogging, running, using a treadmill, these are all cardio forms of exercises which have a lot of importance in weight loss and getting your heart in proper condition, and they're good for heart. But resistance training is extremely important, and as you said, post 40s it becomes even more important, because that's the time when the metabolism is becoming sluggish and one tends to gain weight, especially around the abdomen, and you want to be fit. So what is recommended by ACLM, which is American College of Lifestyle Medicine and Sports Medicine, is that twice a week resistance training is must for a good fitness routine. So if you're doing 4 days of cardio, ensure that 2 days of resistance training is there. It can be in any form. You can do yoga, and do specific exercises which use your body weight in yoga, and you can do it for legs, maybe something like squats, lunges, and later on add weights to it. So this can be a good routine for women post 40s, having twice a week resistance training routine built into their overall fitness regime.
Yes. So yes, that is a very important point, that even if you don't have any equipment to do it, simple body weight exercises can be a great way for you to ensure that you are building some good muscle strength before you reach your 40s, or if it's in the 40s, at least you can get started off with some resistance exercise.
It's never too late to start, even if you are in 40s or 50s or more. Exercise, if you once you know the benefits, once you feel up to it, you can start with simple things like walking and then gradually add things into it. But
And ma'am, any specific medical conditions in which there are added advantages of doing resistance exercises?
Sadly, as you would know, that India has become the diabetes capital of the world, which means the insulin resistance of people here is uh, bad, and bad insulin resistance leads to diabetes mellitus. So even in pregnancy, a lot of cases of gestational diabetes are seen. So resistance training is supposed to actually uh, improve your insulin resistance. It's supposed to improve your lipid profile, and it is also supposed to be good. So hence, it's supposed to be good even for cases like hypertension, and for people who have various forms of arthritis and suffer from pains. starting slowly, gradually building resistance training improves the range of motion around all the joints, and overall health and fitness improves balance, agility, stamina, reduced risk of falls, better posture. There are innumerable benefits.
Right. So, like you mentioned that it is important that for overall improving the medical conditions also. So I think you mentioned almost all the lifestyle diseases, right?
Yes.
So toward
Yes.
overall improvement in the lifestyle also, and to ensure that you try to control your sugar levels, your blood pressure. This is a very good way. So please ensure that, like ma'am mentioned, at least twice in a week you do some form of resistance exercises along with walking or running or jogging. Absolutely continue that, but do add on some form of resistance exercises as well. And ma'am, anything apart from all this, apart from these medical conditions, anything specifically for a women's health perspective, wherein women of various age groups can probably think of if they have to start resistance exercises for the first time, and how also not just improving the overall body shape, also like you mentioned, to improve the muscle mass and to reduce the body fat composition and to get into much fitter state, how resistance exercises can play a big role.
Yeah, as I said, we've covered almost all the points. So resistance training would basically increase the basal metabolic rate. Increased basal metabolic rate would ensure that whatever weight is being lost or that is maintained, and the muscles and bones become stronger. So everything goes hand in hand. Your biochemical parameters, which is like sugars and lipids, are becoming better. So ultimately, you are going towards a better state of health. And a good place to start with, if you've never exercised, never done resistance training, would be under supervision, because a lot of people go wrong with this. Sometimes they do it with a lot of enthusiasm. Even through apps, one can't be very sure of the form. I can't stress it enough that a proper form during resistance training, where you know what muscle is being exercised, and if you are just if putting that muscle under stress, it should not be that you're working under core and only your back is under stress, and then you develop a backache later on. So they should be done under supervision for beginners. And once you're sure, then you can obviously do it on your own. And you can start with very simple things like bands, and then build weights, and then build some yoga exercises, and then stepwise go for it.
Right. And apart from this, even aquatic exercises are a very great form of resistance. So if you are a swimmer, you would probably totally enjoy doing your swimming workouts, and at the same time have some great effects on your muscle strength under the effect of the buoyancy of the water.
Yeah.
So something that you would like to mention about aquatic exercises also, especially for people who love swimming.
Yeah, it's nice, and especially for people who have various forms of pains, like some people have backaches, and also aquatic exercises take care of that. A lot of stress is not placed. You are able to stress only those muscles which you want to kind of work out, and rest other muscles are not taken into account. So it's a good form of isolating muscles and working out. And I think if you love it, just go for it. The only thing is Corona and Delhi winters would be a deterrent. But I'm sure once this is over, one can try all those forms too.
Great. So if you have any questions for us regarding resistance form of exercises, we will be happy to answer them for you. And we are also conducting fitness sessions for pregnant moms every month. So if in case you are a pregnant mom or you know a pregnant mom and you want to help her improve her overall pregnancy fitness, do get in touch at Rose Walk Luxury Hospital for Women, Panchsheel, South Delhi. We have a question here. In which month should I start exercising during pregnancy?
Well, the first month. There is no contraindication for not exercising. If you have not been advised bed rest, if your gynecologist is not, if you're not suffering from any particular condition that that entails bed rest, then you can start it from the first month onwards.
Right. So if you've already been exercising and you found out that you're pregnant, you can continue your exercise routine unless and until your doctor has told you to be extra careful. However, the intensity of the workouts would vary according to each trimester.
Intensity and type.
Yeah,
one would not go, for example, saying very strenuous kind of exercises like some sports, some like one would not run maybe. So any other form of exercise is okay.
Next question is, what exercise can I do in the first 3 months of pregnancy? I think that's pretty much related to the first question only.
Yes.
So, what exercises in the first 3 months, which is basically your first trimester? Maybe light workouts would be good, stretching exercises would be good. You can do resistance exercises using a TheraBand in the first trimester. Some certain yoga asanas will be very good. Simple walking would be very good, unless and until you've been advised bed rest or your gynecologist has specifically told you to avoid any sort of exercise in the first trimester.
I think yoga clearly mentions that some form of exercises cannot be done. So obviously avoid those exercises. Otherwise, if you've already been exercising, then you can continue the same, but not very strenuous. I mean, lifting very heavy weights is no in pregnancy. Don't do that. But light workouts, as Maima said, they can be done.
Next question is, does one tend to bulk up with weights?
No.
That's right.
One doesn't
specifying.
Yes. One doesn't tend to bulk up with weights unless one is doing really heavy weights, and there's no reason why one should bulk up. For bulking up, you need huge muscle mass, if that's what you mean. And huge muscle mass is something which all men are trying to achieve. The ones who are in the gym, ask them, it's not that easy.
I think
doing weights helps you tone your body and achieve a better shape.
It gives you good cuts. So
It
it would
good
reduce
cuts.
the
Yes,
body
good
fat and
cuts.
increase your muscle mass, which you would actually start loving once you start doing
Yes.
it.
In fact, I would say that the inch loss is the first thing that becomes visible. Your trousers might feel a little loose, and then even though you wouldn't have lost that much weight, but these kind of positive things start happening when you start doing weights.
Right. And I think even the body hormones play a huge role, comparing male body versus female body.
Yes.
We have the next question. Belly fat postpartum 3 months, what to do?
I think belly fat means one tends to accumulate fat around the belly after pregnancy. There's no doubt about it. But belly fat in isolation is not something that can be, unless one's going for a cosmetic surgery, of course. If we talk of fitness, then diet and exercise both play a role, because belly fat would mean fat also elsewhere in the body, overall fat, and one needs to reduce weight, one needs to eat healthy, and also exercise. It will go. If you are doing these two things right, and of course other things after baby also play a role. Sleep is haywire, so as much as possible, if you can get lifestyle stuff aligned, like your sleep, your stress, your diet, your exercise, if you can work on all this, especially diet and exercise, belly fat will go postpartum. 3 months maybe is too early. You keep working on it, it will take a little while, but it will go.
I think best part is that if it's 3 months, you can easily get into a postpartum workout.
You can get a regime. Yes, you can get into a regime.
So that will anyway start, you can build up some goals, and then gradually you can increase the intensity of your workouts, and maybe over a period of 6 months, 9 months or 1 year, you can come back to your pre-pregnancy shape.
Of course.
Next question. I am a pregnant woman. My thyroid reading is 7.2 right now. I am taking 50 mcg. I am in my first trimester. Please suggest me how to bring my levels normal. How much thyronorm should be taken?
See, I think that question should be answered by the endocrinologist, the one who's prescribed you. But as far as exercise is concerned, exercise will only help your metabolism, and direct effect on thyroid. I will not say that if you exercise your thyroid readings will come normal, but all other parameters help, and definitely once your metabolism is fine, even thyroid becomes that means everything starts getting aligned, including thyroid. So exercise and diet play a role in that sense. But if you ask me how will exercise get your thyroid low and what dose, I think that kind of a direct correlation doesn't work.
Basically, disturbed thyroid levels would be again related to your lifestyle imbalance. So overall, you should autoimmune also, yes. So you should just look at overall improving your lifestyle habits and just do regular workouts. And for the medication aspect, it's good to follow what the endocrinologist is advising you.
Yes.
And I think you should also not discontinue the medication on your own.
No, not at all.
Yeah.
and it's okay to take it to achieve that level of 2.5.
Okay, we have the next question. Are push-ups okay during pregnancy?
Well, if you are used to push-ups, if you are sure you can keep that balance, if you have been doing them before, at least in the first and second trimester you can, but obviously not in the third trimester when your belly is really huge. But if you're new to push-ups and you're not confident of your balance around them, you should not attempt them.
So
We don't want you falling on your belly downwards while attempting them.
Yes, so if you can do the all four position, you can do the girly push-ups by bending your knees, and girly push-ups will also give you very good strength in the pectoral region, which will also help you for toning of the breast. So girly push-ups will be yes, but the other proper form of push-up would be a no.
Yeah.
Can I do squats in my first trimester is the next question.
Of course you can do.
So if you've been doing it and you want to continue doing it, you can do that, as far as your gynecologist has specifically not mentioned that you need to avoid any certain heavy forms of workouts, or if there's any high risk pregnancy that is involved. Otherwise, you can continue the workout routine that you were following earlier. I think it a lot depends on the pre-pregnancy fitness level.
Fitness level. And second thing I want to mention is that while you're doing some exercise, suppose your body signals you get some sort of signal that something is, there is some kind of different pain somewhere, or you're feeling some discomfort around the abdominal area. Please stop doing that and just pay attention to it. And once you get a green signal from your gynecologist, then you can of course continue them. But otherwise, squats can easily be done in the first trimester, especially if you are used to them and you're sure of the balance around them.
So listen to your body. If your body is telling you that, look, I need a break for a day, it's okay to take a break for a day, rest, and then maybe after a day or two, you can get back to the workout routine again. So we totally enjoyed answering your questions, and ma'am, it was lovely interacting with you. And like always, we've been enjoying our Fitness Fridays to ensure that we are able to make you fit while you stay safe at home during these pandemic times. And in case you're a pregnant mom or you know a pregnant mom and you want us to help you to get fitter during these times, please do get in touch with us. We have a wonderful well-being program for pregnant moms by the name of Bump Prep, and we'll be more than happy to help you to get fitter and better in your pregnancy. So do get in touch with us at Rosewalk Luxury Hospital for Women, Panchsheel in South Delhi. Thank you so much everyone for joining in. Thank you so much, ma'am, for sparing out time.
My pleasure. Thank you.
Take care. Bye-bye.